Welcome to The Explainer. Today, we're diving into one of medicine's most complex, most fascinating mysteries, systemic lupus erythematosus, or SLE for short. Yeah, we're going to break down how the body's own defense system can literally declare a devastating civil war on itself.
So let's start with this question. What if your body's own defenders turned against you? I mean, really think about that. The very system designed to protect you, your immune system, suddenly starts seeing your own cells, your own tissues as hostile targets. This isn't some sci-fi movie plot. It's the day-to-day reality for someone living with lupus.
All right, first up, a disease of many faces. We're going to start by unraveling the first clues. And this is so important because lupus is famously called the great imitator. Why? Well, because its symptoms can look like a million other things, which makes pinning it down incredibly tough.
Just look at this list of clues. I mean, they seem all over the place, right? You've got these really general things that over 90% of patients get, like fatigue, fever, joint pain. And then right next to them, you have these super specific things like the classic butterfly rash across the face or sensitivity to sunlight. It's this wild mix that makes diagnosing it a real piece of detective work for doctors.
And then you see this. This is a huge piece of the puzzle. The disease has a very clear preference. It affects women way, way more than men. We're talking a staggering 9-to-1 ratio, especially during their childbearing years. That right there tells researchers, hey, we need to be looking really closely at hormones and genetics.
Okay, so we've got the clues laid out. Now let's move on to the next part, the body's civil war, where we identify the real culprit. And here's the twist in this mystery. The perpetrator, well, it's shockingly close to home. And there it is. The culprit is your own immune system. The official term for this is autoimmunity, and it's basically a fundamental breakdown of this really important process called self-tolerance. That's the immune system's ability to know the difference between you and not you. When that fails, you get friendly fire on a massive, microscopic scale, causing inflammation and damage everywhere.
So how does this self-destruction actually happen? Well, it's a domino effect. It all starts with that loss of self-tolerance, right? That can be kicked off by a mix of your genetics and some kind of environmental trigger, like sunlight or even a virus. Next, your body starts making these rogue antibodies. These guys then attack your own DNA and form these sticky, damaging clumps called immune complexes. These clumps then travel through your bloodstream and get stuck in your tissues, your kidneys, your skin, your joints, and that's what triggers the massive, widespread inflammation and damage.
All right, let's zoom in on a prime crime scene to see this damage up close. The kidney under attack. Of all the organs lupus can target, the kidneys are one of the most common and honestly, one of the most serious. We're talking about your body's essential filtration system. When lupus attacks the kidneys, it's called lupus nephritis, and it's exactly what it sounds like. The body's filters get clogged. Remember those sticky immune complexes we just talked about? Well, they get trapped in the tiny, delicate filtering units of the kidneys. It's literally like pouring sludge into a high-tech water filter. Everything gets blocked up, and that can lead to really severe, even life-threatening problems. So, to figure out just how bad the damage is, doctors take a small piece of the kidney, a biopsy, and pathologists grade it. They classify it into 6 different classes. Now, you don't need to memorize all of this, but look at class IV. That's the one you really need to know about. It's the most common and the most severe proliferative form. When a patient has class IV, it's a huge red flag that calls for aggressive, immediate treatment to save the kidneys. And when they look at that biopsy under the microscope, they often find this, a classic sign they call the full house pattern. Now, why full house? Well, it's like in poker. It means they're seeing deposits of pretty much everything they could possibly look for. Multiple types of antibodies and immune proteins all crammed in there. It's a telltale fingerprint that screams lupus nephritis. Okay, let's move on. We know lupus is a great imitator, and the damage can be hidden deep inside. So how do you actually crack the code? Well, it all comes down to the detective work of diagnosis. It's about piecing together all the different forms of evidence. The first big clue comes from a blood test. This one looks for something called antinuclear antibodies, or ANA. And get this, more than 97% of patients with lupus test positive. That's a huge number, making it an almost perfect screening test. If you suspect lupus, this is pretty much the first test you run. But, and this is a really, really important but, A positive ANA test is not a smoking gun. It's a critical clue for sure, but it doesn't solve the case on its own. Why? Because you can have a positive ANA and be perfectly healthy, or you could have a different autoimmune disease. So it tells doctors they're on the right track, but it doesn't definitively point the finger at lupus.
So to really build the case, you need more specific evidence. You need the fingerprints. And that's where these other antibodies come in. Two of the big ones are anti-dsDNA and anti-Smith. The anti-dsDNA is super specific and often linked to kidney problems. But the anti-Smith antibody, wow, it's only found in about 30% of patients, but if you have it, it's 99% specific for lupus. That is about as close to a smoking gun as you can get.
All right, so the case is cracked, the diagnosis is made, but the work is far from over. In fact, it's really just the beginning. Now we have to talk about managing the lifelong mystery. Because lupus isn't something that gets cured. It's a chronic condition that has to be managed day in and day out. Let's be clear, right now there is no cure for lupus. But, and this is a huge but, it can absolutely be managed. The whole goal isn't about finding a magic bullet. It's about controlling that overactive immune system, preventing it from causing more damage, and trying to get the disease into remission, which is basically a quiet period with few or no symptoms.
And you can't manage this alone. Because lupus can pop up anywhere in the body. It takes a whole team of experts. Think of the rheumatologist as the quarterback of the team, but they're working with a nephrologist for the kidneys, a dermatologist for the skin, a cardiologist for the heart, you name it. Each specialist is there to guard a specific part of the body from the attack.
So what does that management plan actually look like? Well, it's a mix of things. First, there's medication. A drug called hydroxychloroquine is an absolute cornerstone. Almost every patient is on it. Then, for big flare-ups, you have more powerful immunosuppressants to calm everything down. But just as important is lifestyle. And number one on that list, photoprotection. Staying out of the sun and away from UV light is non-negotiable because sunlight is a major, major trigger for this disease. So you can see lupus is this incredibly complex puzzle. And while science has made amazing progress in understanding how it works, the daily journey for the people living with it, that's a whole other story. It leaves us with a final, really important question to think about. As we get better and better at solving the scientific puzzle, how can we, as a community, do a better job of supporting the people who are actually fighting this internal civil war every single day?